Hey, welcome back. This is Paramedic Project. Thanks for joining us once again. Today, looking at patient positioning for a second episode. Bit of a review first of all on what we talked about last episode, and that is that acknowledgement of the patient position on approach to the patient early on in our patient assessment, and then some great early decision making that allows us to get 360-degree access to the patient, which subsequently allows us to assess the patient and treat the patient really well. So the prone patient today throws a little bit of a curveball into the mix in that these patients have the potential to deteriorate very quickly if we don't make those really good decisions early on in the patient's treatment. And the reason they deteriorate quickly: 1, when they're prone, we can't manage their airway. 2, we can't ventilate them. 3, we can't generally provide the life-saving measures we would otherwise provide. 4, we can't assess them thoroughly either. So it's vitally important, particularly with these patients that are position prone, that we acknowledge that positioning early on when we assess the patient. That might even be when you're in the ambulance, when you pull up at a scene, might be on approach to the patient when you're walking up. It's really important to acknowledge that position and then have it early on in your play for this patient that we're going to roll the patient. Now, of course, a side note, rolling the patients, we know we've got to have C-spine precautions in place. We know we've got to do that gently so we don't exacerbate any of the patient's injuries. So they're my big tips. Prone patients, you must roll them to provide the assessment and the treatment they need and they deserve. It's been Paramedic Project. Thanks for joining us once again. Find us on social media and we'll see you next time.